What to do if your skin looks like this? First things first, usually this has to do with a barrier is impaired. So we want to work on reducing the inflammation as much as possible, which means not using super stripping ingredients. She might be using some retinoids, maybe ones that are too strong for her, maybe some antioxidants, maybe some vitamin C that may be too strong, or she may be using some products that are too thick for her skin type. So there's lots of factors where we deal with closed comedones. The first thing I would do if she was my client is I would ask her entire home care routine. I'd figure out what is causing this congestion. The second thing I would do is I would work on fighting the inflammation. So I would add in a product called lipid serum from Epicutis, or I would add in Glymed Plus fulvic elixir depending on her budget. And once I got to know a little bit more about her, because both of them work on repairing the skin's barrier function and help reduce inflammation. The second thing I would do is I would take her off of any of her physical exfoliants because it looks like we may be scrubbing the skin a little bit, and I would get her on AHAs, which are chemical exfoliants. So I'd probably get her on a mandelic acid serum because that's a really gentle way where I can chemically exfoliate the skin, eat the glue between the skin cells, and allow the skin to breathe. Now, if she was my client, the first time I saw her, I would not be doing any form of extractions. I would actually work on, again, reducing the inflammation, barrier repair. The second time I saw her, because hopefully I got her to a place where her skin is looking really good and it's not as red and inflamed, because I would get her on that mandelic acid, she would have a little bit of purging. I would do some extractions and maybe be able to do a very baby glycolic chemical peel to help smooth this stuff out. And then within a few months, we should be able to get her clear and her barrier back on track.